Good evening, everybody, or good afternoon, everybody. I'm now on live stream. Anyone can join. type. Kasi si Kim, daghan siya yung mga pangutana ba. Di ay kasabot si Kim na anak ko'y harang? Wa mo siya kasabot? Okay. Sige, sige lang. Kay mag-ano rin ako ng magtimpla ko. Oo, kay nanguta naman siya na nung na-reach ko na ba raw yung requirements. Sabi ko, bakit nagtanong siya gano'n? Harang na gani? Sabi ko, Kim, alam mo ba yung kung ano yung requirements? At saka kung kailan ka magkaroon ng harang? Sabi ko gano'n. Sabi ko, mag-attend ka nga ng live stream ko kay ipaliwanag ko sa iyo mga lahat. Marami siya mga tanong tapos siya. Sabi ko, di ba nag-open ka ng video ko? Hindi mo ba nakikita yung skip ads? Sabi ko, huwag mong i-skip yun. Baka naman ini-skip mo. Sabi ko sa kanya. Sige siya, pangutana na kung naanabay, watch hours, ganun. Tapos sabi ko, hindi ako mahilig kasi mag-text. Sabi ko, mag-attend ka na lang ng live, paliwanag ko na lang sa'yo. Kasi, kay gusto ko, kung nasa yung mga pangutana, akong paliwanag ko sa kanya, i-explain ka ba? Tingalig di niya na intindihan yung mga bagay-bagay ba. Kailangan makapaintindi. Kasi mamaya hindi niya alam. Tsaka yung tungkol may tanong din siya tungkol sa Google AdSense, yung mga ganyan. Tsaka yung sabi ko, kailangan maka-reach ng $100 bago ka maka-payout. Kasi kung hindi ka maka-reach niyan, wala kang payout. Sabi ko gano'n. Tapos natanong niya kung magkano ba daw kung kunyari isang view. Ay, sabi ko, wala. Sabi niya, 1 sentimo ba daw? Wala. Ang isang view, wala pang 1 sentimo. 0.00 pa. 0.001. Sabi ko, mag-attend ka lang ng live. Kahit sabi niya, i-cut na raw niya yung live niya. Sabi ko, cut mo muna, kunyari 30 minutes, tapos mamaya, balikan mo na lang kasi hindi man ako magtagal. 1 hour lang ako mag-live. Tapos, bukas na naman uli kay Kapoy man kung masyadong mahaba. Pa isang oras lang. Kasi kung masyadong mahaba, tapos pag lecture unta ko kung meron kayong mga tanong ba tungkol sa laboratory. Unsay tanong nyo sa laboratory, sagutin ko, ganon. Wala ka ba'y pangutana tungkol sa laboratoryan? Kung kay mga question ba tungkol sa laboratory? Kung kay question tungkol sa lab, kay mag question and answer ta. mangutana ka mo, sagutin ko kayo, gano'n. What are the, mag-lecture ko no ko kay akong kape. What are the three popular methods of blood collection? We have three popular methods of blood collection. We have the venipuncture sampling, the arterial sampling, and the finger stick sampling. The venipuncture sampling and the finger stick sampling is usually done by the medical technologist. The arterial sampling is done by the medical doctors. Do you have any questions, Anne? And then talking about the venipuncture, we have three main areas or three veins that are used by the phlebotomist to obtain venous blood specimens: the median cubital, the cephalic, and the basilic veins. Although the veins located in the antecubital area should be considered first for vein selection, there are alternate sites available for venipuncture. Uh, the blood specimen collection and processing, we'll be talking about it. A phlebotomist must have, what is your manner to the patient? Mic, host, andito na ako. Mic, Murag first time lang ko na encounter yung pangalan mo. Mic. Ikaw naman, ninja. Kaya pala nag-ninja ka pod. Nagle-lecture kasi ako tungkol sa lab. Kaya sabi ko, kung meron kayong questions tungkol sa lab, mag-lecture ako. Karon ano sa may mong pangutana dahil? Kanang ang naa ka ba o busy lang? Okay. To continue. Mag-lecture ko A phlebotomist must have professional, courteous, and understanding manner in all contact with the patients. The first step before you collect the blood is to positively identify the patient by two forms of identification. Ask the patient to state and spell his or her name and give you his/her birth date. Of course, aside from the medical record number or his file in the clinic or hospital where he is having his blood examinations. Nag-stop ka na? Nag-lecture ako tungkol sa lab. Baka gusto mong magkumuha ng course na medical technology. O tutluan ta ka. Hain ka naman, day. College ka na ba, day? Mag-college ka pa? Kung mag-college ka, mag-medtech ka na lang. Hindi man may medtech. Sa abroad ba? Hindi man sa abroad. O, ang mga tanong mo kanina, day, ang tanong mo kanina, ang, di ba, requirements and limits sa watch hours. Bago ka ma-monetize, di ba, nakikita mo na yung mga bakod-bakod yung video, na ads. Ibig sabihin yun, monetize ka na. Ibig sabihin na-reach mo na yung requirements. Tapos sabihin mo naman, tanong mo sa akin yung Google AdSense. Kung naka-apply na akong Google AdSense. Dugay na ako dahil na ay Google AdSense. Niadto pa. 8 years ago pa, 2012, na anak ko yung Google AdSense. Kay niadto pa ako nag-vlog. Vlogger ako noon pa. May sarili akong website. Kaya may Google AdSense na ako dati. Kaya lang, syempre, nagtatrabaho, busy. Hindi ko na naasikaso yung YouTube. Hanggang palit na siya ng requirements, diba? Ngayon, nung hindi na ako na-busy masyado, naisipan ko na mag-YouTube. Nung pala, nag-iba na sila ng patakaran. Mayroon na silang mga requirements ngayon, diba? So, kailangan kong i-reach yung requirements para magamit ko yung Google AdSense ko. Kaya nung na-reach ko yung requirements, sandali lang, connect lang yun sa Google AdSense ko. Kasi dati na ako may Google AdSense. Luma na. Dugay ka pa kasi may grade 12 ka pa. Kaya yun. Kaya siguro natingala ka ngayon na ako yung Google AdSense. Dugay na ako na yung Google AdSense. 2012 pa. Kaya, dugay na ako vlogger noon pa. Kaya lang, may sarili akong website noon. Hindi pa uso noon yung masyado yun sa YouTube. Kaya hindi pa. Kaya sabi ko, mag-lecture ko. Kung naamoy pangutana, magsabi lang kasi mag-lecture ako. Blood specimen collection. The first step in acquiring a quality lab test result for any patient is the specimen collection procedure. The venipuncture procedure is complex, requiring skill and knowledge to perform this procedure. What are the several steps required for every successful collection procedure? First, a phlebotomist must have a professional, courteous, and understanding manner in all contact with the patients. First, the first step, of course, is to identify the patient by two forms of identification. Ask the patient to state and spell his or her name and give you his/her birth date. Check this against the requisition paper or electronic request form. Of course, aside from the medical record number, which is personal for the patient only. Check the requisition form for requested test. other patient information, and any special draw requirements. Sometimes the doctor requires some special orders. Gather the tubes and supplies that you will need for the draw. Position the patient in a chair or sitting or lying on a bed, whatever the patient prefers, because some patients they have phobia with respect to blood extraction. They don't want to sit on a chair. They want to lie down, and some they have this problem of dizziness after blood extraction, and they know about this during their past blood extractions. That's why they will warn the phlebotomist about this. Wash your hands. Select a suitable site for venipuncture by placing the tourniquet 3 to 4 inches above the selected puncture site on the patient. Do not put the tourniquet on too tightly or leave it on the patient longer than 1 minute to avoid hemoconcentration. Next, put on non-latex gloves and palpate for a vein. When a vein is selected, cleanse the area in a circular motion, beginning at the site and working outward by a alcohol pad. Allow the area to air dry. After the area is cleansed, it should not be touched or palpated again. If you find it necessary to reevaluate the site by palpation, the area needs to be re-cleansed again before the venipuncture is performed. Ask the patient to make a fist. Avoid pumping the fist. Grasp the patient's arm firmly using your thumb to do the skin taut and anchor the vein. Swiftly insert the needle through the skin into the lumen of the vein. The needle should form a 15 to 30-degree angle with the arm surface. Avoid excess probing. When the last tube is filling, remove the tourniquet. Remove the needle from the patient's arm using a swift backward motion. Place gauze immediately on the puncture site. Apply and hold adequate pressure to avoid the formation of a hematoma. After holding pressure for 1 to 2 minutes, take a fresh piece of gauze or band-aid to the puncture site. Dispose of contaminated materials, supplies in designated containers. We have biohazard containers for sharps. The larger median cubital and cephalic veins are the usual choice, but the basilic vein on the dorsum of the arm or dorsal hand veins are also acceptable. Foot veins are a last resort because of the higher probability of complications. Last na talking. Finger stick procedure. Follow the steps 1 through 5 of the procedure for venipuncture as I have mentioned earlier. The best locations for finger sticks are the third, middle, and fourth ring fingers of the non-dominant hand. That is the third middle. It's the third middle and fourth ring fingers of the non-dominant hand. If you are right-handed, then use the left hand. And if you are left-handed, then use the right hand. Do not use the tip of the finger or the center of the finger. Avoid the side of the finger when there is less soft tissue, where vessels and nerves are located and where the bone is closer to the surface. The second finger tends to have thicker calloused skin. The fifth finger tends to have less soft tissue overlying the bone. Avoid puncturing a finger that is cold or cyanotic, swollen, scarred, or covered with a rash. Siyempre, kung don't take finger prick from that part where it is some skin rash or something. When a site is selected, put on gloves and cleanse the selected puncture area. Massage the finger toward the selected site prior to the puncture. Okay, massage it. Using a sterile safety lancet, make a skin puncture just off the center of the finger pad. The puncture should be made perpendicular to the ridges of the fingerprint so that the drop of blood does not run down the ridges. Wipe away the first drop of blood, which tends to contain excess tissue fluid. Collect the drops of blood into the collection tube device by gentle pressure on the finger. Avoid excessive pressure or milking that may squeeze tissue fluid into the drop of blood. Cup, rotate, and invert the collection device to mix the blood collected. Have the patient hold a small gauze pad over the puncture site for a few minutes to stop the bleeding, like this. Dispose of contaminated materials, supplies in the designated containers. Label all appropriate tubes at the patient bedside. Okay. We finished already the lecture on venipuncture and the finger stick. Okay, Kim, unsa man atong humana ang lecture. Kim. Ay, Kim, naa ka pa ba? Kim, unsa man imong question? Naa kay question ba, Kim? Kim. Nakakapabaan? Hi. How about I'd like to go to the heel stick procedure. The heel stick procedure is used for newborns, especially for newborn screening and for small babies. And of course, the site is the heel. What are the steps in doing the heel stick procedure? First, you have to pre-warm the infant's heel for 3 to 5 minutes to increase the blood flow for easy collection. Wash your hands and put gloves on. Clean the site to be punctured with an alcohol swab. Dry the cleaned area with a dry gauze pad. Hold the baby's foot firmly to avoid sudden movement. Using a stir blood safety lancet, puncture the side of the heel in the appropriate regions. Make the cut across the heel print lines so that a drop of blood can flow freely along the lines and not run down along the lines but across it. Wipe away the first drop of blood with a piece of clean dry cotton. Then, since newborns do not often bleed immediately, use gentle pressure to produce a rounded drop of blood. Do not use excessive pressure because the blood may become diluted with tissue fluids. Fill the required microtainers as needed. We have the yellow top microtainer and the violet top microtainer for CBC. When finished, elevate the heel, place a piece of clean, dry cotton on the puncture site, and hold it in place until the bleeding has stopped. Apply tape or band-aid to area if needed. Be sure to dispose of the lancet in the appropriate sharps container. Dispose of contaminated materials in appropriate waste receptacles. For cotton balls or gauze soaked with the blood, it must be put in the yellow bags. Remove your gloves and wash your hands. And put your gloves in the yellow bags. The order of your blood collection tubes must be drawn in a specific order to avoid cross-contamination of additives between tubes. The recommended order of draw is first the blood culture bottle or tube, yellow or yellow-black top. Second, we have the coagulation tube, the light blue top. Third, the non-additive tube, the red top. And the last row, the additive tubes in this order. The SST or the red, gray, or gold top, which contains a gel separator and clot activator. Sodium heparin, dark green top. PST, dark green top with gold rim, contains lithium heparin, anticoagulant, and a gel separator. The EDTA lavender top, oxalate, fluoride, light gray top, or other additives. Tubes with additives must be thoroughly mixed by inversion. Clotting or erroneous test results may be obtained when the blood is not thoroughly mixed with the additive. And how do you mix it? By gentle inversion. Labeling the sample. All specimens must be received by the laboratory with a legible label containing at least 2 unique identifiers. The specimen must be labeled with the patient's full name, preferably last name first, then first name, and one of the following: the medical record number. Patient's full date of birth must include the month, day, and year, unique requisition identifier label or the medical record number. Areas to avoid when choosing a site for blood draw. What are the different areas? You have extensive scars from burns and surgery. It is difficult to puncture the scar tissue and obtain a specimen. The upper extremity on the side of a previous mastectomy. Test results may be affected because of lymphedema. Hematoma may cause erroneous test results. If another site is not available, collect the specimen distal to the hematoma. Intravenous therapy, the IV, blood transfusions. Fluid may dilute the specimen, so collect from the opposite arm possible. Cannula, fistula, heparin lock. Hospitals have special policies regarding these devices. In general, blood should not be drawn from an arm with a fistula or cannula without consulting the attending physician. Edematous extremities, tissue fluid accumulation alters test results because of the edema. What are the techniques to prevent hemolysis which can interfere with many tests? Mix all tubes with anticoagulant gently, not vigorously shaking because this can cause hemolysis. Just mix the tubes by inversion for 5 to 10 times. Avoid drawing blood from a hematoma. Select another draw site. If using a needle and syringe, avoid drawing the plunger back too forcefully. Must pull the plunger slowly. Make sure the benefuncture site is dry before proceeding with draw. Let the iodine or alcohol dry first before puncturing the site. Avoid a probing traumatic venipuncture. Of course, it can damage the tissues and the skin. Avoid prolonged tourniquet application. No